Reflection Show. My name is Martha Anabida. We have a generation of young people who put themselves in circumstances they are able to come out from. A lot of us are addicted to drugs, hard drugs, illegal drugs, drugs or substances that we are not supposed to take into our system. But unfortunately, we do. How did we get ourselves in there? Some of us genuinely want to stop, we want to come out, but it's so difficult for us. Today, I'll be speaking with a clinical psychologist who will be helping us understand how we can come out from these things and some of the steps we can follow to come out from these things. Let's go for a break. When we are back, we give you more details. Welcome. I'll be speaking with Mr. Peter Mentor Amadu. He's a clinical health psychologist and also the executive director for Total Life Enhancement Center here in Tamale. He's giving us more details in that you can just walk into um, his facility for service. Maybe after the some of us have to go to see whether the way Ghana economy is, whether we are okay there or there is something there. But of course, he'll be giving us more details. You don't just have to wait till you are mad, quote and unquote, or mentally ill that you have to go there. But I think that is something that, dog, you have to, like, everyone once a while have to walk into your facility
Exactly.
for those kind
Some
of.
bit of assessment and
Mm.
some bit of refueling of ourselves.
So do you ask them like will you ask us questions to know that we are okay or something, or you have a template or a system you're able to use to check that?
Yes. So in the area of mental health, where psychology fall under,
Mm.
it's just like going to the hospital and the doctor listening to you and asking you to go to lab. When you meet a psychologist, it's the same way you go to. They will listen to you. They'll ask you to respond to some one or two items, and there we are able to find out what are the issues. Basically, trying to find out your thinking, your feeling, and your behavior. These are the things that govern us. And so, if at the point your thinking is not right, your feeling will not be right, and your behavior will not also be right according to the social context.
Mm.
And that is where the challenge is.
Your
And so,
thinking,
and
your
feeling
feeling.
and your behavior. That's what we talk about. So when I try to simplify mental health, I just tell people the way you think, the way you feel, and the way you behave is mental health.
So when I walk into your facility, you ask me how I've been feeling for some time.
Exactly.
Per my explanation.
Yes, exactly. So we're able to then say, okay, if the thinking has been that negative, what is more likely to happen is that you have been having that sad feeling,
Mm.
you have been having that frustration or regrets, and that will lead you to withdrawing from people, isolation, and that is when the thinking of either harming yourself, harming the next person will come in, and that's the aspect of mental health we really want to talk about.
And most of the times we wait till it gets to that point.
Exactly, exactly. So people wait till a point when it has become that devastating. They are unable to help themselves. Then that's the time we then are looking for. But in the area of mental health, which I will always say that because of my passion for mental health, I always tell people the energy that I put into mental health, especially for the northern zone, is just because the human resource is not available.
Mm.
And so we don't want to wait till a point when we will need the services that we have to travel all the way to Accra,
Mm.
and you go in there and you may not be able to sustain yourself. And so you come back not well supported, not well taken care of because you couldn't even sustain yourself staying in those places. And so, if you permit me, what I'll just say is that in the WHO's definition of mental health, they talk about your ability to decide, know what you want. They talk about coping with daily stresses of life. They talk about working productively and fruitfully, and talk about your contribution to the immediate environment. This is about the definition of mental health. In this definition, no madness.
Mm.
Unfortunately, our understanding of mental health has always come to we see mental health as those walking on the street mad. But sincerely,
All of
I,
us
I,
have.
I in my office, I hardly see people in rags. There are people in suits. There are people in smocks, well dressed, quinte, and all of that. Those who come. It's just because we understand that there can be life challenges. And if there are challenges, what do we need to do? Unfortunately, we do not prioritize the human being, who is the driving force of the economic development that we are all looking at. We're ready to buy the cars. We're ready to build all the structures. That's why maintenance becomes a challenge for us because of the mentality we have about those things. So if the human being, the investment is into the human being, we'd rather be thinking about this man we are engaging, this woman we are employing now. What is her mental state? What is her mental state? Or how is this person functioning? But we just engage them. And most unfortunately, we engage them without assessing these things. So they come because of stress, because of depression, because of anxiety related issues, because of trauma. They come and they are unproductive. And the organization never achieves anything.
It's a big issue. This point, I want us to. My passion has always been about young people.
Yes, sir.
Anything, addiction to unsafe drugs. I think for the purpose of this discussion, I'll use the term unsafe drugs because even on our previous episode where we look at youth against drugs, we came to understand that there are some of the drugs that may not be that can be prescribed or are prescribed,
Yeah.
but it is the way we abuse them that will end up affecting us. Let's go straight and look at addiction. What is addiction about, and how at the end of the year we get so addicted, and how does that affect our mental health?
Yes, so when we talk about addiction, we're talking about a disease. It's a chronic disease that affects the brain and our behavior. The brain, in the sense that the brain is used for thinking. And when the thinking pattern is not appropriate, the behavior that is going to follow and being exhibited by this individual will not be what socially or contextually will be said to be right. And so that is so when an individual uses a substance, in this case a drug, and the implications are so dire, the consequences are there, the individual is unable to stop, and the implications are there for this person. We say addiction has set because you have gotten to a point where even though you know this drug is causing you a lot of harm, the harm can be in the area of your self-care, the harm can be in the area of your work, the harm can be in your family contribution, the harm can be in your social relationship. Yet you are unable to stop. Then you have gotten addicted to that particular substance.
So when you are taking a substance that you are able to stop on that, that is how you like that is addiction.
Yes.
How
Because
does it start? Like, is it something that maybe just wake up to, or what are some of the signs that a young person watching us to see or feel or experience to know that this thing that is happening,
Yes.
I'm getting to be addicted seriously.
yes. So addiction starts by just the social engagement that we have. Maybe the voluntary intake of some substances, till a point when an individual's decision to take or not to take is compromised. Compromise in the sense that you understand that I don't want to do this, but I have weak energy. I am not able to simply say no when that substance is available or it's within the environment. Then you get to the point of where you have that compulsive use, even though it's impacting you negatively. The compulsive use means that I know when I take this drug, I behave in a way that may lands me into challenges. Yet I see that particular drug and I can't stop. Yet I see that particular substance and I can't stop. So there's that compulsion. And that compulsion will lead to extensive exposure on the drug, onto the brain. And this can lead to a lot of consequences in the thinking, in the feeling, and in the behavior of this individual.
How can it be stopped, or how I'm addicted? I want to stop. What can I do to stop being addicted to something?
Is to look for treatment. So addiction is, as I mentioned, is a chronic condition. So it is not something you can just walk in and say, okay, I used to take this particular substance, and so for 2 days I haven't taken, so I'm treated. No, addiction can be treated. So somebody will say it's a capital yes, it can be treated, but it is not that simple. You need to go through a lot of processes. First, you need a complete assessment of you, the person. And the underlying word in the area of addiction is a willingness. Am I ready? People walk into therapy centers and they are not ready. So it never makes results. It never yields anything. But if the individual is ready and willing, that is the first line. So once you are ready and willing, and they ask you, do you want treatment? And it is yes, then you can be helped. But when the person says no, no matter what happens, I tell people in my therapy room, I tell them, you only can spend maximum 1 hour, 1.5, 2 hours, maybe for the first session. The rest may go less than an hour or less. The rest of the 24 hours or 23 hours is yours to keep. What do you do with it? When you come and you feel that energized, do you have the willpower to say, I want to stop? If you don't have that willpower and you start therapy, you probably will just do a while and you get back. And because addiction is also sometimes called relapsing disease, you do well today, tomorrow you are back. You do well today, tomorrow you are back. So it's relapsing. So you are fine for a month, and the following month you jump back into it. So you have relapse. So because of the relapse, we want individuals who are seeking for addiction management, most of the time who will want to keep in the rehab centers, to be well committed and ready to say that I want treatment, and that can be done.
What happens in the rehab centers? They say that somebody is watching you. It's like a school, so they don't give you the so it's like a prison or a school. So when you are on drugs, you wake up, you don't give you the drugs. How is the rehab done? How is the process, the treatment process, effective process done? Somebody might not be able to have access to rehab. How can the family help? So maybe I have a child or a family member who is into drugs. How can I, the parent or the individual, help them? That is if they are willing.
So let me, even before I get to that, let me say that the purpose of supporting individual in the area of rehab is to underscore three main reasons or three main objectives. One, to help this individual stop the drug. Two, to help this individual stay for a very long time without the drug. And then the third one, to have a prolonged follow-up. One of the aspects that we do very well is just to initiate. You initiate and the person is able to stop the drug for 1 or 2 days, but may not sustain it for a very long time. So coming back to the question you asked, how can family members support? So we can have different forms of therapy, just like we have what is termed OPD services and inpatient services in the hospital setting. When you go to a well-established mental health facility like the psychiatric hospital, we also have that. So you can come purposely for the outpatient activity. That is when this individual is convinced he has the supporting, the enabling environment. It means that parents are willing, the community is willing, the immediate family, the immediate social relations are willing to support. This individual can do very well when it comes to outpatient services. But the outpatient services will try to do a lot of what is termed cognitive behavior therapy. That is CBT. Because everything begins from the way you think. If you think, I will find fulfillment in taking substances, I will be glorified in taking substances. And that is what is happening with our youth today. The experimentation on tramadol is just to be high on sex. That is a reality. I want to go 5 rounds. I don't know where that is coming from. And when that is happening, the mentality, if it is not changed, what we call cognitive restructuring. If that doesn't change, the person can be in therapy for 1 year, he will come back and never reformed. And so the outpatient therapy is meant to help this individual who haven't gotten to a very dire consequences or situation, or who are not living with other existing conditions. So when it is this, you have these support services and the environment is that enabling, you can do OPD services or outpatient. Then some others who are in this addiction, yet they are battling depression. They are in this addiction, yet they are battling anxiety. They are in this addiction and battling 1 or 2 physical conditions, what we call co-occurring diseases. You may need to keep them inpatient and monitor and supervise them to ensure that for that long period that they are going to stay, they will be able to have somebody who will keep an eye on them, who will make sure that their treatment is taken as expected. They follow the behavioral interventions that are put in for them for that period. But let me add that addiction management is not easy. It takes a lot of time. So people stay in rehab centers for minimum 6 months. So in 6 months, it's costly. It's not easy. So if you have family that are not able to support, that's why people go to rehab centers and they come back and they say, what happened? The person didn't get the opportunity to complete the whole treatment cycle. And it is not just one-sided. The treatment takes a lot. Beyond the comprehensive assessment, beyond the intervention or care that has been given, and the other activities that are given, you will need to link this individual to make that individual more functional within the environment. And so when you just do one part, which may come with the medication, then the behavioral aspect, the social support systems are not there. The person will fall back. That's the relapsing aspect of addiction.
Is there a system where the government is helping these rehab centers, or it's purely private that you have to always pay?
Yes, in the government facilities, the rehab centers that are available basically are situated in the psychiatric hospitals. And you know, in Ghana, the psychiatric hospitals are in Pantine, Ankafu, and then Accra Psychiatry. These are the areas. But some facilities, government-owned facilities, have some staff who are supporting in these areas. But when it comes to the area, are being supported to engage these individuals. But most of the facilities that are being manned, that are not government-owned, are the well-resourced ones. And so many people now think of going for the private service, which may be expensive for some families, difficult also because they are not located all over the country. Because in fact, in the whole of the northern sector, I would say we don't have a well-resourced rehab center.
Like the northern zone?
Yes, because the one I know happened to be is located in Aramboku. But when you speak to him, he's really not well-resourced because he's doing his part and doing well, but not well-resourced. If you see a well-resourced mental health or rehab center, it's almost competing with some 5-star hotels.
Wow.
Yes, and that's what we are talking about. But unfortunately, we are not yet there. Can we even have the simple opportunities of letting people do outpatient? And that's what Toilet will do. We do only the outpatient because to admit and take care of them is so comprehensive that you may not be able to pay the bills.
So you just
Do rehab. They come for the day and then they go home and they are engaged in different activities.
It's getting very educative here. Let's go for a break. We'll come back with more.
Yele, yele, yela, yele. Praise the Lord, oh. Whoa. Yeah. Are you ready? Okay.
Like a rainbow, so my life made colorful. If you don't know, a life with this man is beautiful. Sing to the glory of God.
Oh yeah, sing to the glory of God.
Sing to the glory of
Oh yeah, sing to the glory of God.
It's He I know. Everywhere I go, it's He I see. Anything I do, it's He I go. Seeking first all things you shall get.
So I believe that we have all come to understand that addiction is real, mental health is real, and nobody is above this. And it can start very small. I think in our previous episode with Youth Against Drugs, I spoke about the fact that some women or some ladies start with tramadol to reduce menstrual cramps, and they end up getting addicted to any small thing they want to take it. Some young men too, they get so tired, they take tramadol, and it gets that addicted. And somebody will say, "Oh, take marijuana, take this," and you end up. And you spend all your money on these drugs. These drugs are not easy. These drugs are quite expensive. So I want to encourage every young person watching me that don't even start. If you haven't started taking drugs, don't even start because it can be tough. You might not have it as easy as someone else. Your friend that you are copying might have a family that can take them to the rehab. But you, so even forget about you, if you're roaming on the street, you go and steal, they'll catch you with their town and beat you and arrest you and all of that. We do not want that to happen. Doctor, yes, you were making a point before we went on the break.
So I was just trying to touch on the principle of addiction management. One is to understand that it's a complex disease, and when you understand it this way, you don't want to put somebody into therapy just for a day or two or a month. And two is to also to understand that no one treatment fits all. So somebody will come with addiction, but what resulted in the addiction, like you just mentioned, somebody else was as a result of menstrual pain, another person was some aches and all of that. The difference route to addiction will tell you that you probably will need to, touch different things. And because they are different components, we can have the psychological aspect, which is the behavioral and counseling session, which is very important. And we also need to understand that one of the principles is to say that medications works. And medication support in the area of withdrawal symptoms, treatment of occurring conditions, and the management of some complications. And then also to understand that addiction management has to do is complex, and so the family support, the community support, the immediate environment support is important. And in that principle of managing, you are trying as much as possible to get back this individual into functionality, to have the ability to be able to re-engage. So work, social support, and the ability to re-engage themselves. So at the end of the day, these are the principles we are looking for when you are sending an individual or you are trying to engage an individual into the area of addiction management. But there are different forms. We can have the psychological part and we can have the medication. It works. But you see, we need a combination of this. So when the powers combine, I told years ago it was all about this Captain Planet. It was about powers combined. When we combine the powers, it becomes greater. So don't say that, oh, I'm using only medication. Maybe there are some behavioral components, the thinking, the feeling, and then even the steps you will take to look for this particular substance. You need some counseling, you need some psychotherapy, and that is why we say combine this. So there is a medication part, there's a medical, and then there is that psychological part. So combining this will have a greater effectiveness when you are dealing with an individual in the area of addiction management.
What are some of the signs that would make a parent or a guardian know that, oh, the person is getting addicted, or maybe even the individual? So as children, what are some of the things that will make you suspect that your child is getting into drugs? Are they something that parents can take?
So, as parents, you should be looking for a child who was that engaging, very social, and quite interactive. All of a sudden is withdrawing. Withdrawing because they sometimes feel that guilt, feel that loneliness of a behavior or an action they have taken. So they try to pull away. Or you observe them put up a particular behavior that is not usual of them. So they are either high or all of a sudden low again. So hyperactivity because they have gotten the substance. And all of a sudden, maybe they become very low and withdrawn from everybody. It means that that particular substance they took for that high energy level has worn out. And so they now begin to withdraw from themselves. Or you realize that this individual is deteriorating physically. I am using this advisably because not everybody who will deteriorate physically is abusing the drug. But you will need to add that also as a check and probably question or have more evaluation. They will always realize that a lot of them are grieving, and in the moment of the grieving, they will want to break every rule to get that. And that's why individuals who are abusing or are addicted, have become addicted to a particular substance, they will do everything to get it. If it means stealing, if it means robbing somebody to go and buy that particular substance, they will do. And that is how far in some individuals can go. So as parents, we need to watch these things.
Yes, some parents themselves who are on drugs.
Yes, sometimes, yes, we say children will learn by what we see. Unfortunately, what parents say and not say, sometimes children hardly pick those things very much. But you are always using a particular substance, and you keep making it look like this is a forbidden thing, this is a forbidden thing, they will try it.
And I feel like
Right.
the common one is smoking.
Exactly.
Parents are usually smoking, fathers especially
Yes.
smoking. And the day you come like, oh, put us to your child, but you are taking it. So if it is wrong, why are you taking
Why are
it
you
as
taking
a
it
father?
as a father?
So what can you tell parents who are on drugs themselves? Some of them just leave the drugs anyhow for their their children have access to it. Their children see them take it. They see them in the I don't want to say the ghettos, like in the local setting, most men or like there is a place where people sit,
Yes.
and you go and see people sitting there smoking and taking other illegal drugs, but they don't want. So how can that behavior impact children or young people who are on drugs?
Yeah, so as parents, what we're simply saying is that that particular substance that you are taking, that particular drug that is taken, is affecting your ability to even contribute or take care of your family. It means it's negative. So your children will see this. And when it happens, the impact is that at a point, some children are not well taken care of in terms of their education, in terms of their nutrition. And before you realize, they themselves then go out to also try. Because the care is not there, a father has taken a particular substance, he doesn't even know where he is. So it becomes difficult even to monitor and find out if children are home and they've eaten and they have been engaged in their homework. So the children will also go out. And peer pressure. They go out, and as a result of peer pressure, they themselves will begin to try because they want to belong. The home or the house situation has become that hostile. I am in a house that father doesn't talk to me, mother doesn't talk to me, nobody engages me. So what it means is that they will look for friends. And when they have friends who are smoking, who are into tramadol, and they find them, they want to belong, they will try it. And once they try it and they have that energy or they feel very high about it, what it means is that they are going to be with these people. They'll tell you I'm going for extra classes and they'll branch somewhere. They'll tell you I'm visiting this person and they'll branch somewhere before you realize they have gotten used to it. And the curiosity of the youth will be satisfied. And when that is satisfied, you see themselves being hooked on. And that is why substance abuse, if the care is not taken or addiction situation, it can run in families because a parent is into it. The care for the children are not there. They themselves will get people who will use their energy to take it. And so it can run in families. So you find a father, you find a son, and you may find a daughter into this behavior.
What are some of the possible follow-ups misbehavior young people are likely to have because they are addicted, they haven't had rehab, they are going through a lot of mental issues that can easily affect the family and all of that?
Yes, so you will find most of them engage in reckless behaviors. So they are, you find them and they want to do things that doesn't look very normal because at that moment they have so much energy and that can lead them to trouble. And sometimes they may engage in risky sexual behaviors, which they can lead them to contracting sexual transmitted infection. They may even go as far as joining gangs to rob others. And this can lead them into prison or come into challenges with the law. And the law will have to take its course. Or some of them can even go as far as hurting other people. Hurting other people. Because when the energy is high, they are on drugs, they really don't care who they are talking to, who they are dealing with. So they can become very harmful to themselves and to people around. And so in effect, when your child obviously go to damage the windscreen of another person's car because he was high on drugs, you have to pay for it. And so that may even end up leading you to the police station. And if you don't take care, you may land yourself in prison. And your dreams can be shattered because you have simply put up a behavior that was not appropriate because you were high on some drugs or something. And so because of the addiction challenges that you are having.
I'm getting so emotional about this because sometimes it's very tough and it's very difficult asking young people to stop.
Yes.
Some of them are not even willing to go to the rehab.
Yes.
They don't even find it important to do so. So with that, how can we still encourage them to stop taking drugs?
So with the youth, what we have been doing as an organization for the past 3-4 years has been engaging them at the schools, engaging them at their various locations, at the churches, and all of that. So it is to create more awareness. People know, but you see, at a point, it's not about. I mean, addiction will not just stop because you say, "Oh, those it's no good," but we need to provide them with alternatives. Recently, we have a project we call the Tamale Gateways Project. We visited, and you see, most of them are individuals who have some handiwork. They are masons, they are carpenters, they are electricians, and all of that. But why are they into this? They tell you the support systems are not there. So, in order for us to be able to tell the youth, stop, we must provide the alternative. And the alternative is that we have to get them meaningfully engaged. So, the youth from school need to be engaged. And so we let youth understand that the engagement we are talking about sometimes may not all be about money. Volunteering to learn something is something great that a lot of young ones today don't want to talk about. But you volunteer, you build a skill, and that skill will serve you one day. And that's what we are talking about. You engage yourself positively. So duty bearers are supposed to create the enabling environment. And sometimes the substances are greatly available that you wonder. Unfortunately, you know the tramadol that is being abused is not an approved drug by the Ministry of Health. No. What the ministry approves of is 50 milligrams and 100 milligrams. This will not lead you to the addiction that we're talking
And
about.
some will buy.
Some of them buy.
100 take
Yes.
100 times. Yeah,
We
it's
have
100
some
times.
as high as 200 or even 2,000 milligrams, and people are using them where they got them unapproved routes that it has gotten into our system. So we need to check our borders and we need to sanitize the system and let people understand that when the drugs are available, our youth will use them, and the youth we are preparing today to lead us tomorrow will not be available. And we have a bleak future.
I think it's a quick money. Maybe the government are doing enough, but the pharmacies, the drugstores, the over-the-counter medication
Yes.
sellers, what I think they are the most primary people we need to focus on
Exactly.
because they want to make quick cash.
Exactly.
What can we tell them?
You see, in actual fact, if you find a professional pharmacist, will not sell this. It is the quack ones in the system that are doing this, and that's why the Pharmacy Council is there as a regulator to weed out these quacks from the system. And so, what we need to do is to say that individuals engaged in the sales of medication need to be professional. Once you begin, you put money first, you will sell to any other person who comes around, and that can affect our ability to control this. And so we need to be professional in our ability to dispense medication at our pharmacy shops, at the hospitals, and within our localities. So
What is
professionalism
the
will be
important need for treatment? Why do we have to focus on getting professional treatment?
Yes.
on that?
So treatment becomes very important because treatment will help this individual who is in the area of addiction to think of changing the thinking, changing the feeling and behavior, and by effect, attitude will be changed, and the understanding they have will also be changed. And so when treatment is targeted, we aim to ensure that people understand this concept, knowing very well it has an impact on me, it has a burden on my family, it has a burden on the community in which I live, and it has a burden on the nation. Of late, we see within town, every evening by 5 when I'm driving home, I see a number of police officers stationed at different vantage points. State resources, yes, they were supposed to do this, but because the system has become that insecure, they have to intensify the police visibility just to tell people that if you do the wrong thing, the law will catch up with you. And many of the time, those who are engaged in this substance drug abuse or have gotten used to this and have been addicted are always engaging in behaviors that will go against the law. And that is the reason why we need to put all this in place. So all this will gear towards helping us say that duty bearers have a role, all of us. And the advocacy we are doing, it plays a role because what we're just engaging now is to tell the individuals that you see, addiction will lead to a lot of challenges. It will affect your personal development, it will affect your ability to contribute to the community in which you are, and it will affect your productivity. And so addiction is something you need to stay away from as a youth. If you really want to achieve, let me be a bit spiritual here, your God-given talent, to unearth that God-given talent in you need to stay away from drugs.
What are some of the emerging trends you've come across in your area of work? Things that young people are doing that can go a long way to affect our mental health?
Yeah, so the emerging trends basically have to do with the high use of tramadol among our youth, high use of emergency contraceptive among our young girls. Emergency contraceptive so may not be something that you're using like 2-3 times in a month, or you mean in a quarter. And you find them use it like paracetamol, and that has an impact.
Yeah.
And the emerging trends are that a lot of youth are engaged, and this is from the United Nations Office of Drug Office. They say that a lot of the youth, aged 15 years, are engaging.
Who makes the drugs available? Where do they get them?
Yes,
Where are they still producing them?
well, drugs are produced for a purpose to take care of us. When the system goes wrong, drugs are supposed to be able to support us. So medications are meant to help correct variation or challenges in the body. There's pain, there's some pain medications, but how we use them is what actually gets us into trouble. So when we use them, the fun of it and making it look like I can be on it, and because we are using it for the wrong purpose. Every drug has a purpose. And if we use the drug for this purpose, we'll never get to where we are and talking about. But because a lot of us are using the drug wrongly, and we can't say, the nation cannot say we can't import drug or can't manufacture drug, because when you are sick, you go for operation, you go for labor case and all of that, you need medication, but they must be used for the purpose for which they have been created or manufactured. But when the drug is being now used and shifted into different purposes beyond for the reason for which they were manufactured, that is where we have those challenges.
That is where we have those challenges. Let's move on. I'll be back. We delve into more.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Marcus King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of Kingdom Dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle, and many more.
I want to encourage parents to pay extra attention to their children. You have to monitor your children. You don't even have to drink in front of your children. You don't have to take cigarettes in front of your children. There are some things you might think that they are not watching, but you see, as young as 2 years old, children sometimes even say things that you wonder where they heard them from. I saw a 4-year or is it a 5-year-old girl, the two girls, about 6, yeah. I don't even think it'll be up to 6, and they bear the same name. So the girl saw the colleague, and someone mentioned the name Pearl, and she said, "You are called Pearl. Why are you called Pearl?" 4 years, and she wanted to understand why her name is Pearl, and the other girl's name is Pearl. And the way she was asking the colleague, I was amazed. I was just laughing, and I was like, wow. This is something that you won't even think that a 4-year-old or a 5-year-old would want to know why. see parents, guardians, everybody who is into the CSOs, into young people empowerment, we need to pay extra attention. Should I say fortunately or unfortunately, our focus has shifted onto adolescent reproductive health. I'm not saying it's wrong, but I feel that we should have a comprehensive view of letting them understand that this is something also equally important. Because somebody can be on drugs and go and rape someone.
Exactly.
Somebody can be on drugs and be sexually aroused and want to go and sleep with someone. And all of these pregnancy issues will come up, which I think we can solve. Doctor, we have just barely 10 minutes. What are your most important information that everyone should take home?
Well, even just to say that the challenge as regards at drug or substance use indicates that about almost over 275 million individuals aged between 15 and above or 45 are engaged in substance use. And when you come to the African setting, we are told that in the next by the year 2050, the drug use or addiction related challenges would have gone 150%. And in the Ghanaian context, is to say that there are a lot more of young ones who are engaged in substance use. And sometimes it brings a lot of challenges for parents, it brings a lot of challenges for society, it brings a lot of challenges for duty bearers. So we all need to play the role. And what is that role? My role, what we have now as CSO, is to advocate. And that is why some of us have even gone further to create what we term the outpatient rehab centers for individuals to walk in and receive this service. But the challenge is that some people come and they are looking for quick fix. Psychology is not quick fix now. So you come and we have to take time. And people don't have the patience to wait. Do I have to do 10 sessions? I said yes. They go, they never come. And that's where the challenge is. People need to understand that in the area of rehab, it's a lot of energy, it's a lot of commitment that needs to be put. And as parents, we all need to get involved in duty bearers. So what will I then be saying as take home? Addiction can be managed. As I said, capital yes, but it involves a lot of processes. So if you have a son who is into this, if you have a daughter who is into this, you yourself, you are challenged. It can be managed. You only need to be willing and ready, and the support service can be available for you. We know there are successful treatment areas that you can log into. So if you are looking for help, visit any of our health centers and they will direct you. In the area of private services, TOLEC is available to provide individual with the care. But we understand that the behavioral intervention as well as medication, when combined, will give us a lot of support.
Yeah.
But the group that I so much speak passionately for, the youth is a focus area for me. But another group is individuals in the area in prison or those who come into challenges with the law because they are using substances. Sometimes they don't get the support. Our prison
Arrest
services,
them,
and then
take them, so automatically they stop taking. So that's the rehab.
and
They don't go through any kind of
yes,
counseling.
and they need some support beyond that.
And I think even addiction, the rehab, like how do they call it? Withdrawal
Symptoms. Yes,
It can affect them, and if it's not managed well,
Well.
it can be a bigger issue.
a challenge.
And that is what the prisons are not doing, because it's like, come and catch me taking cocaine or weed.
Yes.
You just arrest me today, and the next day I'm where? I'm
Mm.
in the prison. So that's all. I don't know what's happening to me again.
And so when they begin to show the withdrawal symptoms, what do we do? What I mean, the facilities may not be
I
available
don't
for
even
them.
think the prison they even get good health care.
Well, that is another area that I see. If we can do so much around the prison and the prison mental health, I'm sure we'll do a lot of
Exactly.
because prison is a place where when you go for reformation, you don't come out more hardened than before. Unfortunately, that is the situation we find some in prison situations. So we want people to go in there and they are reformed and come out. And so, but when they go in there and the systems are not there, what is that reformation they are looking for? So maybe as duty bearers, we need to really echo and let people understand that our prisons are meant to create change When you go in there and that change is not received, then your purpose for going to prison was like just like stopping you and making you do nothing for yourself for the rest of your life, and that will not be helpful. So all of us have a role. At Tole, what we do is
Yeah,
advocacy.
coming to that, yeah.
Total Life Enhancement Center Ghana is a psychology-focused organization engaged in the area of mental health advocacy, psychological provision, counseling services, emotional intelligence and management, and capacity building. Why emotional intelligence? We have a lot of people who the IQ there is there, but social connection is never there. So they'll get the job and tomorrow they are fired. Emotional intelligence is what they are lacking. Even though intelligence quotient IQ is there, but social relations lacking, and so they will never get a sustained job. And some of them they stay in there, they will never get the promotion out there. So this is what we have been doing, and we have been in this system for a little over 5 years. I can say it's passion. Passion because what I do, I hardly get funded, and I teach at the University for Development Studies, at the School of Medicine. I teach psychology. But this is a passion. So when I'm not teaching, this is what I am doing. So mental health is passion for me that I carry in the whole of the law. So I speak about mental health like nobody else in business, because I know very well when we get it very well in the area of mental health, we would have gotten it right. And that is why when the WHO defined mental health years ago, they say without mental health, there is no true health without mental health. So for you to be truly healthy, you must be mentally healthy. And so if you go to the hospital, and you're not getting well, you need to see a psychologist, you need to see a mental health practitioner. Unfortunately, where are they? The whole of the north. I don't know how many psychologists. We are really. Sometimes when I say, people say, you are scaring us. But that's the truth. We barely have less than 5 psychiatrists in the whole of northern region. And our psychologists is still the same, in that same number. So it means that the human resource is not available. When it comes to mental health, funding readily not available. Quite recently, the newly inaugurated board for the Mental Health Authority, they are calling for funding to be able to execute a lot of backlog of activities. Why is it? You will have some people who come in, and because of poor literacy, one of the areas we try to tackle as an institution, the literacy level about mental health is low. So when you are talking about mental health, people are, but we are not mad. And unfortunately, mental health goes beyond madness. And so that is all that we have been doing for the past 5 years. And we still want to do more.
Where can you be
And
located in Tamale?
yes, Total Life Enhancement Center Ghana, TOLEC for short, is located on the Jusnaili Road around King David, just directly behind PPAG Ghana.
Oh, okay.
So we're just behind PPAG. So it is our new location, and it is a place where we have
Just by the luxury.
luxury behind luxury actually. It's actually behind luxury. So from King David, you can locate us behind luxury.
Okay.
But our route is just directly opposite Farm Gate.
Okay.
So Farm Gate is our route that you will need to Tole. And Tole has a team of psychologists, a team of psychiatrists, a team of psychiatric nurses, medical officers, and a lot of individuals who are passionate. I say at Tole we have a lot of passionate individuals, and we drive the change, especially youth empowerment and supporting individuals have meaningful lives.
Youth empowerment and to support individuals with meaningful life. It's been an amazing session, especially for me, because I've got to, it's like every time I get to learn something new on the show, speaking with different people with diverse knowledge, information on different fields. And if you've been following, you understand that our topics are geared towards making you have something to reflect on. It's the reflection show. After every episode, we should be able to reflect on something that is going to help. I have been speaking with Mr. Peter Mentor Amadu, the clinical health psychologist, and also the executive director for Total Life Enhancement Center here in Tamale. They have just given the direction to their place. Let me quickly can I give your phone number now?
Yes.
Yeah, so if you want to get in touch with Doctor, just call 024 215 4006. 024 215 4006. And now we are in a virtual world. can get in touch with him and you can have a virtual session with him anywhere at any time. And you can also send us a message if you didn't get the contacts correctly. We could share doctor's contact with you as well. And also, hopefully, we'll share on our social media platforms, and you can also get in touch with him. If you're in Tamale, just get to Black Shoes, see the signpost, and you can follow him. So, my hair and makeup is by Angel's Beauty Salon here in Tamale. This is a new product. I think just 1 or 2 months into the market, and I just want to support a friend bringing out this together. Get in touch with them on 054 629 2084. It's a NAT organization producing the Sopam product. This is the African liquid black soap. This is the lemongrass and tea tree flavor. They also have the mango flavor, and they also have the shampoo as well. Ladies, for our hair, it's just 12 Ghana cedis, and you can use it for some time. And wherever you are, you're looking for the African shea butter, you can also get this for a 12 Ghana cedis. Just give them a call or give us a message to get in touch with them. And then if you're in Tamale, you can get in touch with them at Jisonai, just almost opposite the Tamale International School. So when you get to the Tamale International School, just go a little bit, like some 5 seconds, to see their building, the Sopam Limited, and get in touch with them for all of these amazing flavors. We still call it on partners and sponsors for the Reflection Show. Come and sponsor us. We have amazing packages for you. Give us a call on 054 9578 512. 054 9578 512. We do understand that the Reflection Show ends in the night. There are times that a lot of you call, we may be unable to pick up your call. Please send us a text message or a WhatsApp message, and the team will get back to you. Sometimes when the show, even though it's a pre-recorded show, but the call sometimes keeps getting a lot. Some of you also take our WhatsApp number. You send us messages that are not appropriate. Somebody even added the number to a lotto group something and send us pictures that are not appropriate. It's an official number, so anybody can be with the number at any time. Sometimes I have the number, sometimes my other team members have the phone with me. I mean, so when you are calling, you will call at 10 p.m. So just call us during the day. You can just pick up the information or the question you need and leave a message. And when it is a working day, even if it's a weekend and we are available, we'll give you a reply. But please don't call. If I were married, you probably should see my husband. So please do well to get in touch at their appropriate hours, even though we want to reach out to you. Thank you very much. My name is Martha Anabila. Thank you for watching. Have a good night. Hello and welcome to Thoughts from Martha Inspires. I am Martha Anabila. Today I want to talk to you about what I have captioned, do you want to grow? There are lots of times we say I want to grow, I want to become bigger in this, I want to become bigger in that, but we don't plan ourselves for the price we have to pay. In your career, do you want to grow? Even in age, do you want to grow? In your Christian life, do you want to grow? In your business, do you want to grow? Are you ready for the price, for the disappointment, the issues that comes with growth? As you are growing, are you sure that you want to grow? Because growth is painful, growth is selfish, growth is annoying, growth is something that will make you feel uncomfortable. Every business person understands that if you want to grow, you have to make a lot of sacrifices. Are you ready for that kind of sacrifice? Are you sure that you want to grow? In whatever endeavor you are partaking in life, I want you to understand that there is a price that you have to pay for you to grow. Sometimes we are like, oh, I want to grow, I want to do this, I want to do that, but we have forgotten that there is a serious price that we have to pay for us to grow, and we end up thinking that, oh, because this didn't work and that didn't work, I am quitting.
If you want to grow, you have to be ready for the price, be ready for the sacrifices, the disappointment, the pain, the anger that comes with growth. Growth is not easy. And as every young person watching me today, understand that there is this kind of pain, emotional pain, psychological pain that you will encounter at every level of your growth. So if you are growing in business, you are growing in health, you are growing in age, in any way that you are growing, understand that there will be challenges, there will be issues. People will leave you, they will become angry with you, and they will hurt you. But you know what? There is always light at the end of the tunnel. Whatever you are going through, whatever issues you are facing, it's part of the growth that you are seeking for. It's part of the growth that you are hoping for. So be able to understand that you need to pay for the price. Pay for the price. And the price comes in different ways. The price comes differently from different people. Somebody can be paying a price differently, but you will not pay the same price. So if you want to compare your growth with other people's growth, then you would never be able to grow in the way you have to grow, because growth is different. Grow gracefully. Grow graciously. Grow according to your strength. Do not copy people's growth. Grow because it's something that is going to make you outstanding. It's something that's going to make you great and amazing and wonderful. Growth is good. Growth is wonderful. But do not copy how people grow, because your endeavors and your growth would never be the same as other people would grow. So if you want to grow, understand the process, understand the mandate, and grow in that endeavor. Don't say, oh, 2-3 years, nothing is coming on. I'm not seeing profit. I'm not seeing that. Growth is painful. Growth is annoying. Growth it's something that is not pleasant. Growth is not easy. I believe that if you have watched this episode, you've understood that you have to go through the process of growth and be the best version of yourself, and don't compare any other person. Thank you for watching today's episode on Thoughts from Martha Inspires. I am Martha Anabila. See you next time.